All, all right. I apologize for that, guys. So we are going to, again, talk about several topics. This is a 4 weeks class. We're going to do high level today, and then we will work and break these down in each session. We're going to talk about just understanding blood pressure better, the definition, how our blood pressure is measured. We're going to go through the levels of blood pressure, and then we'll explore the risk of the having uncontrolled hypertension and why it's so important to manage it with dietary adjustments and physical exercise. And then we're also going to talk about the stress of blood pressure and on our body, and then just the importance of self-monitoring. All right, so what is hypertension, or commonly known as high blood pressure? It is a condition where the pressure of the blood against the artery wall is consistently too high, often referred to as the silent killer. It usually has no symptoms. So many of you probably have been walking around a little elevated and you think, hey, I feel fine, I don't feel bad. But just to know that many a times that's how it is. You don't have any symptoms, and that is why it's called a silent killer. But in the meantime, it can be leading to severe complications such as heart disease or stroke. So if not managed properly. Blood pressure is reported by two numbers. I'm sure if you've ever gone in the clinic, you saw this on the machine, or you've had your printout, or if you're monitoring at home, you know there's a top number and there's a bottom number. The systolic pressure, which is the higher number, or that top number, I don't really like to say higher because it may not necessarily, some people think it's the higher reading, but it's the top number, and it measures the pressure in your arteries during heartbeats. A normal systolic pressure is less than 120 milligrams of mercury. So less than, that's a key here. It's not equal to, but it's less than 120. And a diastolic measures the pressure in the arteries between the heartbeats, where the normal reading of less than 80. So understanding these numbers are crucial in managing your blood pressure. All right. So out of everything we're going to go through today, I think this right here is one of the biggest kind of aha moments, or you might have a little light bulb that goes off and like, I did not know this. Or there may be several of you in the class that are very much aware of what your numbers are and what they mean. So just take a minute to look at this diagram and think about where you fall. Normal is green, elevated is in the yellow, orange is stage 1, and then you've got the different shades of red for stage 2, and then a hypertensive crisis. So as you're sitting here looking about what color you fall in, you are probably maybe a little shocked to realize that elevated is 120 to 129. You probably thought you were sitting great if you were like 122, right? Well, just want to make sure that you're aware that that is actually elevated. So that's a great time to start thinking, if you've not been diagnosed with high blood pressure, it's a great time to start thinking about, what can I do to get myself back in the green? Is it, lifestyle changes, just a little adding some exercise or watching my diet? Normal is less than 120 and less than 80. Elevated is the 120 to 129 and less than 80. And stage 1 of hypertension or high blood pressure is 130 to 139 or 80 over 89. You can see high blood pressure stage 2 is 140 or higher, or a diastolic, or that bottom number, of 90 or higher. And then a hypertensive crisis is higher than 180, and or that diastolic or bottom number being higher than 120. So many of you are probably saying that, you thought 128, 130 was not bad. And not necessarily horrible, but consistent readings of those numbers are actually stage 1. So if you're seeing any of these numbers and you're shocked where you found yourself, maybe you've been living in the 130s and your doctor hasn't said anything to you, then I encourage you just to have that conversation with your provider. Now, one reading of these numbers doesn't diagnose you. Your provider is going to take multiple readings, before you're going to actually get that diagnosis. If you have been diagnosed with hypertension, your goal that your provider has set may not fall in that normal category. And we're going to talk more about that in other sessions, okay? All right, so what are the risks of uncontrolled hypertension? We've talked about what hypertension is. We've talked about the categories and where your numbers, kind of knowing your numbers and understanding that. So now, what are the risks if I don't do anything about these numbers and I let them get out of control? Uncontrolled hypertension can increase your risk of several serious health issues. Obviously, and you probably know this, but if not, it can lead to heart disease, including heart failure, coronary artery disease, which is due to hardened arteries. And we're going to watch a really good video the next week about those hardened arteries. It can cause stroke by clogging or bursting the brain blood vessels, and can cause kidney damage, which may progress to kidney failure, or causing scarring of the kidney filters, which some of you may know someone that's had to go on dialysis because of their kidney disease, because of their blood pressure, or maybe because of diabetes or such. Additionally, hypertension can cause aneurysms due to those weakened artery walls. So many of you may know someone that's actually had a stroke, or a heart attack from their blood pressure. It is more common these days. But I just want to make sure that you all understand, when you're walking around with these numbers of like 140s, 150s, and maybe you don't feel bad, that underneath you're causing some damage. And that, again, is why it's called the silent killer. And it can end up causing these things, or kidney disease, and then some other complications that you may not be familiar with or as familiar with. And that's effects on our vision. So we can have, adverse effects on our vision, called some retinopathy. We can have blocked blood flow, which can cause irreversible damage to our optic nerve. We can have fluid buildup under our retina, causing vision distortion. So managing your blood pressure is essential for maintaining a healthy heart and healthy kidneys, but also for your eye health and just overall quality of life. So what are the benefits? Well, I think you probably know that answer if you have been paying attention, right? Because we talked about what blood pressure is, our numbers, and the why. Well, if you understand the why, what we're preventing, well, then that leads to the benefits, obviously. Because if you're managing it well, you're going to prevent all those complications and the risks that we just talked about. So effectively managing your blood pressure will reduce all those health risks that we just discussed. It will lessen the strain on your heart and arteries, lowers that risk of chronic kidney disease, and helps prevent those vision loss and damage to those retinal blood vessels. But not only does controlling that blood pressure improve your physical health, but it will also enhance your overall quality of life and can significantly extend your life expectancy. So we've talked about what it is, why we need to control it, and here are the benefits. All right, so now we're talking about how do I get my numbers in control. Now, again, this session is very kind of high level. We're throwing kind of everything we're going to talk about in the next 4 weeks. We're going to break these topics down in the next sessions. And there's a link on the dietary adjustments in the chat that's already been posted by Ms. Holly. But if you're not in here and you want this emailed, we can. But the DASH diet is specifically designed to lower your blood pressure, focusing on the heart healthy nutrients. It includes eating less sodium, more fruits and vegetables, and plenty of whole grains and low-fat dairy products. This also, obviously, will support some weight management, which is going to reduce those risks of diabetes and other chronic disease. So you can see on the slide here that it's recommending that it aims for less than 2,300 milligrams of sodium or salt daily, but ideal, specifically if you have been diagnosed with hypertension, is going to be under the 1,500. And your doctor may have set something a little different for you, and I encourage you to follow that. But these are just general population here, recommendations for the DASH diet. So if your doctor has put you on a specific sodium level, maybe you have some other things going on as well, then adhere to that. You need to focus on fruits and vegetables, encouraging 4 to 5 servings a day. Let's be honest, that's hard, right? That is really hard this day and age. Everything is so fast-paced. We're on the go. But we really need to try to figure out how to get back to the basics with our diet and eliminate or really decrease all those processed foods that we consume. So 4 to 5 servings. Now, I want to throw a caveat out here. If you are a diabetic, along with hypertension, you are more than likely, unless you're very, very well controlled, not going to be able to withstand 4 servings of fruit, okay? So I encourage you, when you're doing this, there's a balance there. And I would lean more toward your vegetable servings and more like your green vegetables with that. And kind of have to play around with checking your glucose to kind of see what you can handle with those fruits. And your berries and your apples are going to be much better of a fruit choice if you're a diabetic than your melons and bananas and things like that. So 4 to 5 servings each day. If you're diabetic, we've got to be careful and figure out that balance with those. Whole grains, 6 to 8 servings, rich in fiber. So that's wheat, bread, brown rice. Same thing with our diabetics. We kind of have to kind of watch our numbers with that as well. And then low-fat dairy is 2 to 3 servings. This is like skim milk, low-fat yogurt. It's going to provide your calcium, protein, and vitamin D. So what are the benefits of a DASH diet? I wonder, what are we talking about here, right? Obviously, it's going to help with that blood pressure reduction. And you guys, it significantly lowers your systolic and diastolic. Research shows that often within 2 weeks, if you adhere to this diet, you follow it, then you're going to see results in 2 weeks. It's going to reduce the risk of heart attacks and strokes because it's cutting out all those unhealthy fats and cholesterol. It's going to improve and help with supporting your optimal weight because it's helping lower that blood pressure. And then that high fiber, low sugar diet is going to help stabilize your blood glucose and insulin levels, which are going to reduce the risk of your diabetes or prediabetes. It's going to reduce chronic disease, other chronic disease, because it promotes that healthy eating pattern, which is going to decrease the likelihood of developing osteoporosis and other cancers, which when we're eliminating all those high processed foods, we're decreasing a lot of the inflammation sources in our diet, which is also going to help with our overall health as well. So what are some dietary tips? And I would love if you guys want to throw anything in the chat about what's worked for you. If you found a good tip and want to share it, pop it in the chat. I think that's one of the great things about these classes like that is there's so much information out there. It's hard to pull in 30 minutes, and I always love to hear from what people are doing or found that really worked from them because it can very well help someone else out. But to start with, we need to figure out how do we cut back on that salt. One good thing is start reading your labels. Be aware of what you're consuming. Try to track that. There's so many apps out there, or we could just go old school to pen and paper and monitor it from there. Instead of salt, why not spice up things with herbs? And that's a great way to really add flavor to your diet, and it's a healthier choice. And I'm telling you guys, if you really take the time to add those herbs and spices instead of salt, really going to change the flavor of your food. You're going to enjoy it a lot better. And that's a simple switch. When you're out at the store looking for things, try to find the no added salt or no salt. Again, read those labels. Be aware of what you're consuming. And then, avoid those processed foods high in sodium. Try not to go through McDonald's every night or Burger King. And I know that we live in a fast-paced society. We're on the go so much. We want things on demand. We're a society that a culture, we want it now. And then also just the cost. I know you can go through and feed your family of 4 for around $20 or less at McDonald's. Can't really do that anywhere else in a drive-through, probably. But I encourage you to just think of ways to get creative. If you have to eat McDonald's or Burger King, then if you're somewhere that has the chicken, choose the grilled chicken. Eliminate the fries. If they have a fruit cup, choose the fruit cup. If you're at McDonald's, they don't have the salads anymore, they don't have the fruit, then just get the burger if you have to, or the chicken, and just don't do the fries. And try to minimize the number of times that you're doing this. All right. Like I said, if anybody has anything they want to put in the chat about any tips that's worked for them, we'll dive in more of that in our other sessions. But I'd love to hear that feedback. All right. So what is the best health class without talking about physical activity, right? We're not going to have a class without talking about some sort of physical activity. But, we talk about it so much because it's important. Regular exercise is crucial for effectively managing your hypertension. It's right there in red. It's going to help lower that blood pressure, improve your heart health, and aid in weight management. And guys, just being physically active, just in general, makes our mood better. Mentally, we're better when we're physically active. So walking is most people can do this. Now, granted, I know some people have some issues with knees and things like that, but in general, walking is very low impact. It's easily integrated into our daily life. We should aim for 30 minutes of brisk walking most days, but guys, if you can't commit to 30 or you're not doing anything right now, 30 minutes is very daunting, very overwhelming. Just start where you can. It may be 5 minutes a couple of times a day, or just 10 minutes is all you can start with. Start small, find a way to figure it in, commit to it, be consistent, and then build on it. Cycling is also another great, especially if you have joint issues. It's an effective way of lowering your blood pressure, boosting that heart health. It's gentle on the joints. A stationary bike, you could always use your incentive dollars to buy a stationary bike or a walking pad or something like that. It's a great way to spend that money. Swimming, it's great if we have access to a pool all year round, right? We don't all have that, but if you do, it's a great for a full body workout and cardiovascular benefits, and also obviously just joint and muscle stress. So, do I have to say it? What are the benefits of regular exercise on our blood pressure and health? I feel like we probably all know this. We know it. We just don't adhere to it. But it enhances that circulation, lowers bad cholesterol, boosts those good cholesterol, those HDLs. I know you see those on your biometric, and it decreases your workload on the heart. It's also going to help with weight management, which is maintaining that healthy weight is crucial for blood pressure. It's crucial for many things in our health. It's going to improve our body's insulin use and glucose absorption. It's going to reduce stress. Remember, I talked about this. It's great for your mental health. It's a natural stress reliever, lowering that temporary spikes in blood pressure. Because having frequent spikes in blood pressure because of your stress long-term is not good. We're all going to have some. It's flight or flight. It's just human nature, but we need to try to minimize that as much as we can. And then it's just going to improve sleep. Being physically active, we're tired, we're going to sleep better. And all that indirectly benefits our blood pressure and our health. So what are some tips on exercising? What can you do? My biggest thing here is just, start small. So many people have these big ideas, like first of the year. That's always your New Year's resolution, going to the gym and things like that. And then what happens? Life happens, it fizzles out, and some do, and that is great, but some aren't consistent, don't stay with it. So I encourage you just, start small and build. But you want variety. You want to mix cardiovascular and strength training, especially in our 30s and after we start losing muscle. And it is so important to try to figure out how we can add a little resistance and strength training. Flexibility exercises, yoga, Pilates, all those things are great. You can do those at home with videos nowadays. You don't have to pay gym memberships or things like that for workouts. And you don't have to have equipment. You can get creative and figure out things at home or buy a few bands or a few lightweights. Because a lot of times it's not about the heaviness of the weight, it's just the number of the reps that you get. We want to be consistent. Schedule at regular exercise times. Try to work it in on your calendar. It needs to be treated as an important appointment. And something we enjoy. If you hate walking on a treadmill, do not set walking on a treadmill as your goal. You are not going to stick with it. So choose things that are enjoyable and try to add a friend or outdoors when you can. There's just so many different things. There's these, you can even incorporate technology. These VRs that these kids have, they have exercise activities on those, and you can do that with other people. They've got little boxing apps on those things. I've seen people just sweating like crazy doing those. There's so many opportunities that you can do. But also having friends and having that accountability partner is great as well. If you set the goal to yourself, you may struggle. But if you share it with someone else, someone that you know is going to call you out on it, then you're more likely to succeed in it. And again, what I've been saying is incremental goals. Just set small, pursue those small, achieve those. You're going to gain motivation and gradually increase the duration. And once you get started, I assure you, you're going to feel better and you're going to crave it. You're going to want it. So what are the impacts of stress on our hypertension and the management techniques? So direct impact is stress can trigger hormones that surge and increase blood pressure by accelerating our heart rate and narrowing those blood vessels. Indirect, it can lead to unhealthy habits like poor diet, increased alcohol. Hey, we've had a stressful day, need a little extra glass of wine, maybe you think. So it's still impacting you. Causes you to have lack of exercise. You just don't feel motivated. And then we start, having poor sleep habits. And like I said, the biggest thing here I think about was we start kind of emotionally or stress eating. All of that can exacerbate our hypertension. Stress-induced hypertension, I kind of talked about this on the slide before, is temporary or significant blood pressure spikes during acute stress episodes. And that's going to happen some. That's just life. But we need to minimize these because frequent can be dangerous. Also, just want to shout out to the concern if you are struggling with a lot of depression, anxiety, that is a free service to our health plan members. So I believe that was listed in the chat as well. If not, I can reach out. I can make sure you have that contact information. So what are some things that you can do to minimize stress? You can do breathing exercises, meditation, and just muscle relaxation techniques. I know we got just a little bit late start, so we are right at the 12:30. Normally, I would have you guys take a minute to do this practical session on relaxation. I want to be mindful of your time, so I will make sure everybody on the call has this technique emailed to them. But it's something you can do anywhere. You can sit, lie down, probably not going to do that at work, but you can do that at home. But you could do it at your desk. You place one hand over your belly and the other on your chest. You're going to breathe in deeply through your nose, expand your belly for a count of 4, hold your breath, and exhale slowly. And then you're going to repeat that several times. I promise, guys, it does make a difference. And I normally would make you do it, but I'm going to skip through to finish our session so we're not running over. But I will email this out to you all, and I really encourage you to take a minute to do that today. And then therefore, a couple times every day. Wrapping up with the importance of self-monitoring. Why is it important to self-monitoring? It is such a key in managing your hypertension. Remember, out of sight, out of mind, okay? If we don't know what our numbers are, we're assuming, and a lot of times our assumptions are wrong. It helps you keep track of your blood pressure readings. You can also log your food, your dietary changes, and see how those are affecting your numbers. And all this is great because it helps you stay consistent, but it also helps your provider to make necessary change in your plan of care. There's so many ways to track. There's logs, there's apps. I mean, I'm sure you all know about these out there. And at the end of the day, you could just get a journal and journal these things and journal your stress and what's going on. All of this is just going to help hold you accountable and let us track and help your provider as well track patterns and help you identify things that affect your numbers. All right. So just 1 minute over, considering we got a late start, I think I did pretty good. Sorry about all the technical issues that we had today. You will be receiving the JOT form if you didn't scan the QR code. That's going to be coming in an email. So it's not mandatory, but I really encourage you, if you have a way of monitoring your blood pressure, let us know. We'd like to just see if anything you're doing through the class, if we make a difference at the end of the 4 weeks. All right, that's all I have. Does anybody want to come off mute and ask any questions? And if not, you are free to drop off the call if you've got somewhere to be. But I'll stay on for just a few minutes to ask any questions, or you're welcome to email me or Holly if you don't feel comfortable asking it in the group. We'll be glad to follow up with you. Thanks, guys. Thanks, everyone. Thanks for all the thank yous. So I've got a question here. How often do you recommend we take our blood pressure? Is it necessarily to take it daily? So I would say if you've not been diagnosed with hypertension and when you've gone in and checked it, you're not seeing any issues and your numbers fell in the normal, then I wouldn't say you have to run out and buy a machine to check it at home every day. If you're keeping your appointments a couple of times a year and you've not been diagnosed with hypertension and your numbers are already well, I think you're fine just keeping seeing your provider.
Let me give you the password.
Twice a year.
The password is just going to be.
Hang on just a second, sir. I'm gonna mute you. Sorry, I didn't want you to pass out a password. I apologize. All right. So on that, but if you are diagnosed with high blood pressure, then and you're struggling daily, you need to be recording at least daily and keeping that log. If you're well managed, if you've been well managed, then I would just check it a couple of times a week just to make sure. Because what it is, if you're not going into your doctor but every 6 months and you have high blood pressure, again, it's out of sight, it's out of mind. You could be having some fluctuations and not even aware of it. Because remember, many times you don't have symptoms. So that answer is kind of depending on if you have high blood pressure, if you don't, if you're having issues, on how often you monitor it. Any other questions? Oh, yeah. So what is how to correct way to take it? So first thing in the morning is really good before you've had any caffeine, because I mean, we live in a world that we kind of thrive off caffeine, right? And I'm not here saying you can't have it, or you shouldn't have it. I mean, at the end of the day, it is not the most healthy thing we can have, but that I would tell you just to take up with your doctors. You know, some people can have some caffeine and be fine, and some people cannot. But caffeine can elevate your blood pressure and cause tachycardia. But sitting first thing in the morning before any stimulants, caffeine or anything, coffee or energy drink or anything like that, pay attention to these drinks these days. We have a lot of different health drinks out there and energy drinks that have some natural caffeine and things in it. But first thing in the morning, sitting, if you can empty your bladder, it's much better. You're going to get a more accurate reading. A full bladder can cause a higher number as well. If you have not had a bowel movement, if you've been constipated, things like that. But first thing in the morning, no stimulant, feet flat on the ground, okay? You don't want to run around trying to get everybody out the door to school and work and then take your blood pressure. So you want to take a few minutes, just kind of calm and collect yourself. Don't be talking, don't be moving, making sure your legs are not crossed and that you don't have any big bulky clothes on is going to be the best time to take that. Now, if you're struggling with your readings and you're taking medications and you're taking it twice a day and things like that, or you feel like your numbers are changing, like morning and afternoon is a great time just to compare those. But ideally, taking it when you first get up in the morning without any caffeine. And then if you are a caffeine drinker, I encourage you to take it then and then take it later in the day when you've had a couple things of caffeine and see the difference. There's also within the chat, there is a link on a diagram on the tips on how to sit, how to place your arm, and things like that as well. Any other questions? All right. Well, that will conclude our class today. If you want to keep adding questions, I'll keep a look in that and follow back up. Like I said, there was a lot of great things in the chat. We will be emailing the link to the JOT form. And if you think of any other resources that we, can share with you, we'll be glad to do that. You can just reach out by email as well. I hope everyone stays safe and has a great rest of their afternoon. And we will see you guys next week at the same time.